Good afternoon. My name is Mike Stearns. I'm the Director of Pharmacy at Ellenville Regional Hospital in Ellenville, New York. I want to welcome you to the third installment of our Facebook Live project with the Rural Health. And today I'd like to talk about a few different things, but today's kind of a special day. It's kind of a happy day and a sad day for us here at the hospital, at least in the pharmacy department. We've had a student with us for 3 weeks from Albany College of Pharmacy, Kira Fairley, and I'm going to introduce Kira in a couple minutes to talk about her experience while she was here. The Ellenville Regional Hospital does education in many different modalities, and pharmacy is one of those, and one of the ones we did first here. We trained doctoral level students of pharmacy. I would encourage people to consider using the hospital. I know we're in some serious times now with COVID, but the hospital is actually a very safe place to come and use our services. Many of our services have reopened and are available, and we've taken precautions to mitigate any spread of COVID. People have to wash their hands and get their temperatures taken before they come in, and that includes all staff. So we're a pretty safe place right now. And certainly I am meeting with outpatients in pharmacy as well to discuss medications. And the telephone number here for the pharmacy to get a hold of me to make an appointment for medication review is 845-647-6400, and my extension is 229. So please give me a call, come in, and we can talk about your medications and varying degrees and all about your medications and answer the questions that you may have about those. And we also encourage you to use your community pharmacists as well as your providers to answer those questions as well. So I think at this point I would like to introduce Kira so she can kind of give us a recap of her experience here, and hopefully we hope to have her back in the future after she finishes another didactic year of study at Albany College of Pharmacy. So, Kira?
Yes, I hope to be able to come back for my advanced rotations. Today I'm finishing up my introductory rotations. I've been here for 3 weeks, and since the beginning everyone has been so welcoming, and I have been impressed on how well each individual unit of the hospital works together as a cohesive team. They meet several times a month, and I've been able to sit in on some of those meetings and learn about how the hospital functions. One of my favorite things that I've done while I've been here is we got to meet with some people from the community that came in to discuss their medications, and we got to answer some questions with them or for them, and talk about the scheduling of their medications as well. Sometimes it can be hard to figure out when to take all of your doses, or how to take your medications properly, or what to do if you do miss a dose. So we got to address a lot of those questions, and it was very enjoyable to be able to help them. We also get to do rounds for people who are staying in the hospital, and we recently got to start doing that again, since previously with COVID we weren't able to actually go into the patient rooms, but I've enjoyed recently being able to do that again. And as Mike was stating before, he's always available, so I would encourage you guys as well to come in to the hospital if you'd like to go over any medication questions with Mike. And you can also always give your local pharmacist in the retail setting a call as well. And yes, I've really enjoyed my time here.
Yeah, you got to meet a lot of different people, not just in pharmacy, but nursing and providers. You got to work with providers as well as patients, and it's a really good experience. I think it's a great place to come, especially for learning hospital pharmacy, because it's we do a lot of things very well, and one of the things we introduced Kira to was antibiotic stewardship, which is a big byword these days, and I was fortunate enough a couple of years ago to be invited down to CDC in Atlanta to participate with other directors of pharmacy from other small hospitals in the United States to create a framework and a booklet for how to do antibiotic stewardship in small hospitals with limited budget and limited staff. So we've come a long ways with antibiotic stewardship. Some of the important parts of antibiotic stewardship are intervening to get people from IV to oral medications as soon as possible, to reduce the likelihood of antimicrobial or antibiotic resistance, which is a big thing today, to also to prioritize how we give antibiotics, also how we can manage them better to reduce likelihood of side effects and poor effects of maybe perhaps the wrong antibiotic being chosen. So we've come a long way with that in the past few years. We were instrumental in helping other hospitals in the United States be able to implement programs for antibiotic stewardship. But today I'd like to focus on a class of medications that many people take and many people have challenges with for varying reasons. We talked about this book a couple weeks ago, the ERH Most Frequently Administered Medication Guide, and this is really from our inpatient program, and Kira actually started working on the top 30 for the emergency department, which we're going to pass along to the next student, and then the next student to work on until we complete it. But this book is a very excellent booklet, and we talked about the 10 questions that are on the back cover of this booklet, and we're going to talk about more specifics today about medications for high blood pressure. High blood pressure is a silent killer, and one of the things that I asked Kira to research while she was here, and I do ask all of my students, because I think it's very important information on what we call chronotherapy, or what is the best time to take certain medications. And blood pressure medications that I've asked Kira to take a look at primarily are the angiotensin receptor blockers and the ACE inhibitors, and she'll talk more about those in a couple minutes. There are many classes of blood pressure medications. Many of them have many side effects, including they have a major effect at what we want from that medication, but some of them have side effects as well, and sometimes the timing of taking those medications can result in better outcomes and lessening of the side effects. So one of the classes that I want to talk about is a very common class of blood pressure treatment medication, and that's called diuretics, and those are commonly known as water pills, and really they just work to reduce the amount of water in your circulatory system, and so by taking out a certain volume of water, it lessens the pressure. Okay, so those type of medications, the diuretics, the water pills, we want to take those in the morning, because if you take those at night, you may be up all night going to the bathroom, waking up, and having to make many trips. So we would prefer to take those in the morning. Those cause you to urinate quite frequently, and some of them have some important side effects with those, of taking out extra potassium or extra sodium, which can have some negative effects in the body. So people often have to supplement water pills with potassium tablets, whether they're prescribed over the counter, and your doctor will monitor your what they call electrolytes with blood tests periodically with those. Now the diuretics are probably one of the blood pressure lowering medications that affect the activities, what we call activities of daily living, the most, because you have to know where the next bathroom is. You have to, once you take that pill, you need to know where the nearest bathroom is, because you're going to urinate frequently. So sometimes if people have other things that they need to do during the day, like go to the doctor's office or go to the store or do something with friends, they may elect not to take that medication, which is not really a good thing, but it's something that allows them to do what they need to do for that day. The problem with that is that you then lose the blood pressure lowering effect of that medication for that day. So a lot of times people that take diuretics are not what we would call the most compliant with taking a water pill or diuretic. So if you're taking a diuretic, we would encourage you to take it as prescribed. And if you don't, when you go back to your physician or caregiver, your provider, and they ask you if you're taking your blood pressure medication regularly, please tell them the truth. Like if you do skip doses to go to the doctor's office or out for some reason, so they know that you're not taking it as prescribed. Because what happens is if you are prescribed a medication and you tell your provider that you're taking them and you may not be taking them, maybe only 2/3 of the time, many times the provider may want to increase or change medications if your blood pressure is still up. And the fact of the matter may be that you're not being compliant in taking the medication. So we encourage you to be truthful with your providers as to whether you are taking, especially water pills, correctly or not, because it does impact your treatment and what can be prescribed down the road. Another type of blood pressure medication for more serious blood pressure that we can't control with the medications Kira's going to be talking about, would be medications that act centrally, like in the central nervous system, things like clonidine, which affects the outflow from the brain of nervous system information about blood pressure management. So those tend to have a lot more side effects, such as drowsiness and along those lines. So those are kind of some of the more serious, more other ones that we're going to talk about. What Kira's going to talk about are kind of the mainstream focus of the most recent information available on the treatment of hypertension through algorithms that have been developed from JNC8 for many years, so that we can all really be on the same kind of page. So again, if you would like to talk with me or my students about medications, your medications, how they're best managed, please give us a call at 647-6400, extension 229, to set up an appointment, and I'd be more than happy to meet with you. I know that's one of the things I like to do a lot, and my students also like to do that as well. So let me just turn it over to Kira once again, and she's going to talk a little bit about the category of blood pressure medications, which are very widely used these days, called ACEIs, which are ACE inhibitors that have to do with, well, I'll leave it for Kira to tell you how they work, and then also angiotensin receptor blockers. So Kira?
Yes. So with the research that I did, as Mike just said, I looked at the classes, the ACEs and ARBs, and they work to reduce the renin-angiotensin-aldosterone system, also known as ROS, and it decreases the activity, and it has a large impact on how your blood pressure is controlled. So some examples of ARBs are valsartan, losartan, candesartan, and some examples of ACEs are lisinopril, benzapril, ramipril, quinapril, and these are very common. So even if you don't take them, you may know somebody who does take them or have heard of them before. So through the research, a lot of it is based on blood pressure follows a circadian rhythm. So at nighttime, around 3 to 4 a.m., your blood pressure normally drops, and this is for a normal patient. Somebody who may not even have high blood pressure or low blood pressure, they follow this circadian rhythm, and then in the mornings it tends to increase. And with these medications, it helps to continue these circadian rhythms. So you will have the dipping at night and then an increase in the morning. But with people who have high blood pressure, the medications can help so that morning surge in blood pressure is not too high. So by taking the medication at night, you will kind of re-stimulate this normal pattern. So you will have your normal dipping pattern, and in the morning your blood pressure will not surge as high as it would if you were to take this medication in the morning, or if it was taken in the morning, it may require a greater dose so that it lasts the full 24 hours. And you get the surge in the morning because your body releases hormones and it boosts the energy in your body, and in turn it increases your blood pressure. So the conclusion from this research was that you should take your ACEs and ARBs at bedtime. Another common side effect of blood pressure medication that Mike did mention for another class, but is also true for the ACEs and ARBs, is that you can become sleepy and have drowsiness when you take it. So it also helps to take it at night, as that's when you're going to sleep, versus if you take it in the morning, you could be drowsy throughout the day. And with that surge in the morning, it normally happens right when you wake up. And a lot of people tend to take their blood pressure medications with their breakfast if they do take it in the morning. So they could actually have a gap in coverage from that morning surge to when they take it if the medication has worn off by then. So it could make you more prone to an increased risk of a stroke or other cardiac events. So if you, I would advise you that you should talk to your doctor if you do not take the medication in the evening currently, and see if they think that that could be helpful for you.
Thanks, Kara. Yeah, it's one of the things that I commonly recommend is moving ACEs and ARBs to bedtime dosing, because it just seems to be, for most people, a better way of managing that particular type of blood pressure medication. And as Kara mentioned, and maybe I can draw a little illustration to the morning surge. If you've ever been late for something in the morning, you know, like if you're a student late for a class or an adult late for work, and all of a sudden you like wake up and you have this overwhelming surge of body chemicals that wake you up, cortisol, epinephrine, norepinephrine, all the things that wake us up. It's perhaps not quite to that degree, but it's similar. So that's when a lot of people become more likely to have cardiac events or strokes. And so one of the things that we do normally in treatment, if somebody comes in with an MI or a heart attack, is to ask them if they took a beta blocker or an ACE inhibitor or an ARB already, and if they haven't, we're going to give it to them along with aspirin usually. And so the thinking is that, and the research is that if we give these type of medicines, the ACEs and the ARBs, which primarily work at the level of the ROS system, that we can, by having these drugs on board, we prevent the formation or much decrease the formation by angiotensin 2, which increases the tone on the blood vessels and drives up the blood pressure, which is in most cases the opposite of what we want during an MI or a stroke, because it increases the work of the heart, and also increasing the tone of the blood vessels may be counterproductive to the treatment that we're trying to do at the time. So if we have these medications already on board from the night before, they tend to last almost up to 24 hours in the body, and they're certainly there when the body needs them the most in these as a therapeutic intervention in some of these very serious situations that can occur in the human body. So the research, and there's been some that goes back and forth, and Kira looked at a lot of the different pro and con type of studies, but the summary of all the studies is that in most cases it's quite beneficial to take these medications at night. And the other thing too, and I think Kira mentioned it as well, is that many blood pressure medications have a side effect of drowsiness. So if you have a side effect of drowsiness and you're trying to sleep at night, you know, some people take sleep medications, but if you move some of your blood pressure medications to nighttime, maybe you won't need that sleep medication anymore, because the side effect of the drowsiness may be helpful in you being able to go to sleep and get a good night's sleep. So there's a lot of positive things about that. But I guess the key fact of all that is you have to remember to take your medicine. And I think sometimes a lot of people forget in the evening. So one of the things that folks can often do, I mean, we live in the age of cell phones and whatnot. You can set your alarm on a cell phone to remind you to take medications at a certain time. There's scheduling programs and different things that can be used with smartphones to remind you if you have challenges in remembering to take medication at night. So I think those are some of the blood pressure medications. Another one that we didn't mention too much was beta blockers. Very, very, very widely used medication for blood pressure control are beta blockers. There's many different names. There's metoprolol, short-acting, long-acting toprolol, and Lopressor, atenolol, tenormin. So there's quite a few out there, different varieties of those as well, and they work very well to help control blood pressure as also. So one of the things that happens too, and I think we probably mentioned this in the past, but there's a phenomenon called orthostatic hypotension that occurs with people who take blood pressure medications fairly frequently. And all this is that your body doesn't respond as quickly to changes in position as it can without the medications present. So in a person who's not taking medications that modify their blood pressure, normally you can go from laying down to standing up without falling down in a heap. But with people who take blood pressure medications, because of the effect on the different mechanisms in the body that maintain blood pressure, going from laying down to standing, the body may not be able to respond as quickly to that change in position, and you may get dizzy and you may faint or fall. So our recommendation with people who take blood pressure medications is never to go from laying to standing. So you go from laying to sitting, sitting to standing. Okay, that gives your body a chance to respond to those changes in position much better. So orthostatic hypotension is the actual term for that, and it occurs fairly frequently. So we often tell people go from laying down to sitting and sitting to standing. The other time that you can notice the challenges in change of position is if you spin around very quickly. Sometimes your body, when you're on taking blood pressure medications, can't respond to that spin as quickly. So sometimes people get a little faint or a little dizzy. And some of that can be modified by changing timing of medications, which is another reason that we encourage people to speak with their provider, their pharmacist, their caregiver about the best times for them to take medications. And we talk about, the number of medications people take from time to time. The number is not necessarily the true indicator of challenges people have with medications, but how many doses per day. And I think we talked about this before. But if you're feeling stressed about the number of doses per day that you take, it's worth having a conversation with your provider or your pharmacist about how these could be streamlined or combined, or taking medications together, whether that's a good idea or not a good idea. We have a number of people probably that take thyroid medication out there, and what many people don't know is that you probably shouldn't take your thyroid medication with certain elements. And what I mean by elements are like calcium, magnesium, because those can negatively impact the amount of thyroid absorbed, and may lead to misinformation for the provider when they're writing prescriptions and whatnot. So it's important to understand how dietary taking things in your diet can affect how medications work as well. So another reason to have conversation about your diet, I think we talked about this before, but it can't be stressed, ever under stressed, is people taking the anticoagulant warfarin or Coumadin or Angiotensin. These are vitamin K dependent mechanisms in the clotting mechanism, that clotting cascade actually, that are modified. And if you take vitamin K in your diet, either through vitamins, and a lot of people don't realize your multivitamins often contain vitamin K, but there's also vitamin K sources of in food that we eat, green vegetables, some other vegetables, that can impact the effectiveness of this anticoagulant and can negate the effects of the anticoagulant and make people more likely to form clots with all the issues that can go along with clots. So it's important to also have that conversation with your providers and their pharmacists if you're taking anticoagulants, because particularly the warfarin, Coumadin, Angiotensin type anticoagulants are negatively impacted by the ingestion of vitamin K in whatever form. So important things to think about. Diet does have, what you eat in your diet does have an impact on certain medications. So I would encourage people to have that conversation as well. So again, welcome to our Facebook Live. We're going to do this every 2 weeks on Friday at noon. We hope to get some feedback from people on questions that they have. You can call me as well with questions to the hospital. Phone number is area code 845-647-6400. My extension is 229, and we'd be happy to answer medication-related questions. Not so good with stock market questions and things like that, but medication questions, we can field those well. We also have a very extensive outpatient infusion program here at the hospital through specialty services, where we can do many different types of IV medications if people need those. We had a case recently, a few months ago, where a person who was going to Albany to get an IV medication once a month was able to come here and save 180-mile, several-hour round trip. So we do have a fairly robust IV infusion capability here at the hospital, and would encourage people to give us a call about those things as well. And I just wanted to just say one other thing about the ACEs and ARBs, the angiotensin receptor blockers and the angiotensin converting enzyme inhibitors, which, because that's a mouthful, we call them ACEs. Okay, is that there's some research now with COVID that indicates that the way that the COVID virus gets into the body is through injecting its RNA, latching on to what we call ACE2 receptor, and injecting that RNA material in the cell, and that's how the invasion into the body occurs. And that by people taking these angiotensin receptor blockers or ARBs or ACE inhibitors may make that a little bit more challenging for the COVID virus to attack those particular human cells known as ACE2 receptors. So for those people who are taking that, you may have a little bit more protection. Again, this is a lot of research that's coming out now. There's a lot of research going on COVID. We don't have all the answers. Every week we have more information, and there's hundreds of laboratories around the world working on how to more effectively treat COVID. So probably in the next 2 weeks from now, we'll be able to update you a little bit more on the current research on what's going on with COVID, but to definitely give us a call if you have any questions about medication. Several of the medications that are available now, and you probably see in the news, remdesivir and dexamethasone from a study in England. These are right now being reserved for the most seriously ill COVID 19 patients who are in intensive care units. These are not preventative, so I wouldn't rush out and buy them or get them. They're really reserved for people who already have severe COVID disease, and we'd like to keep that supply available, so not everybody should have supplies of these in their medicine cabinet at this point. Okay, well, thank you very much. Give us a call for any questions.